Good afternoon and welcome to Arkansas Children's Remote Facebook Live. This afternoon, I'm joined by Karen Smith with the Arkansas Children's Research Institute. And January is Birth Defects and Prevention Month. And so this afternoon, we'll be talking with Karen about birth defects and prevention and how Arkansas Children's and the Research Institute supports this month. So welcome, Karen.
Thank you. I'm very happy to be here. I'm actually the research manager for the Arkansas Reproductive Health Monitoring System at ACRI, and that is better known as the Birth Defects Registry.
Excellent. And I wanted Karen to give some more explanation about her title and what she does. So Karen, I think you are the perfect subject matter expert for this afternoon as we dive into really what birth defects are and how they can be prevented. So let's start at the beginning. And if you could help us really understand what a birth defect is and how common they are.
Birth defects are very common, a lot more common than you would think. And a simplified definition of a birth defect would be a birth outcome that has a suboptimal outcome. And that can affect how the body works or how it looks, or it could affect both.
That's interesting. And you said that they are common, and we definitely want to talk about that in a minute. But let's talk about what causes birth defects for moms who are listening or young women who are listening. What causes them so that they can understand that better when it comes to birth defects?
Most birth defects we don't know the actual cause of, but those that we do know the cause of actually are caused by things like genetics, hereditary, or possibly smoking cigarettes, alcohol use, using drugs such as prescription drugs or even illegal drugs, things like that. Exposure to environmental elements or even a disease of some sort, a transmitted disease or infectious disease, I should say, during pregnancy. Things like that would possibly cause and increase the risk for a birth defect.
Let's talk about Arkansas. How does Arkansas rank when it comes to babies born with birth defects?
Well, if you want to look at the United States, 1 out of every 33 babies born in the United States may have a birth defect. And they could be ranging from a very small visual birth defect or even something more serious like spina bifida or a congenital heart defect. In Arkansas, we actually there are typically 393,000 on average, give or take, of babies born per year. Okay, and out of those 393,000, there will be 260 stillbirths, approximately. And then if you look at those, we collect data on approximately 1,100 birth defects up to maybe 1,400 per year at the Birth Defects Registry, if that tells you kind of a comparison there.
It's interesting that you mentioned birth defects can be something very minor, maybe that the regular public wouldn't even notice. So there's a range when it comes to birth defects, is what you're saying.
Yes, I mean, it may be something that is identified at birth that is visual, like a cleft lip or a cleft palate, for example. Or it could be a heart defect or it could be something that is not identified until later in that child's life. We follow babies that where the birth defect is identified between the ages of 1 and 2, and then follow them up until they turn 5 years old. But a birth defect is not does not mean that it was just identified at birth. It could have been identified later in life, and someone may be 80 years old and have a birth defect.
Questions was when are birth defects usually discovered, but now it sounds like it could happen anytime in someone's life, but when are they usually discovered?
Well, typically in the first couple of years of life, but it depends on what that birth defect is. And it could, like, I'm sure you've heard on the news where some athletes that did not know they had a heart defect suddenly died or something like that, or had some kind of collapse and that's when the birth defect was identified. So it really can be identified anytime during your life. More
That's
commonly at birth, though.
that's fascinating. Let's talk about prevention. So when you hear about birth defects and how common they are, there's the positive side that there are prevention and ways that moms can take care of themselves now, even before they get pregnant. Can you talk about some prevention tactics?
The number one thing that is recommended is folic acid. There have been studies showing that 400 micrograms, excuse me, of folic acid can reduce neural tube defects by approximately 50 to 70% if taken about 1 month prior to birth, and then during the first 1 month before pregnancy, and during the first trimester of pregnancy. And it's shown to prevent about 50 to 70% reduction in birth defects by doing that. You can also increase your folic acid intake by your diet. For example, eating leafy greens, having cereal for breakfast that is high in folic acid. Read those labels and try to get the one that has 100% of the minimum average intake for your for the day, so that you can help do it naturally. But again, they do recommend that you do a supplement. And one thing that we always highly recommend is that prenatal follow-up and care. That's very, very important. And sometimes birth defects can be identified by an ultrasound, for example.
In your cereal and in vegetables. So to know that is easy to get and makes such a difference on the baby is good news. Hopefully for moms who are watching, and moms who are women who want to get pregnant. Let's talk about how Arkansas Children's and the Research Institute supports moms who have babies born with birth defects from the womb and when they need care.
Okay, one way would be we partner, Arkansas Children's partners with UAMS and their Angels program to identify birth defects and as and birth defects in high risk pregnancies, I should say. It's very recommended that they be identified early so that you can start preparing for whatever outcome at birth and even after birth, and to have those specialists there. Some infants are actually transferred to us immediately following birth and are followed in our NICU. and admitted there. Others are followed in a specialty clinic by a specialist. An example would be a genetics expert, specialist, or a um, cardiologist, for example.
I love that. So yes, if it's identified before the baby gets here, the specialists that are at Arkansas Children's can support the mom and the family through what care that they need. Talking about, and
Mhm.
people who are watching, it is January. January is Birth Defects and Prevention Month. What can people who are watching, how can they get involved, and how can they help in this prevention month?
Well, they can help by spreading the word about folic acid, encourage mothers or those in childbirthing age to take folic acid. And we know that all pregnancies are not planned. So taking the folic acid will naturally help with that. Go for follow-up, encourage women to take care of themselves, watch their weight, uh, take take care of their diabetes if they have any pre-existing conditions, things like that, and prenatal care. Encourage people, women, and spread the word. Spread the word. That's the most important thing. If you are aware, you can take action.
That's excellent. I think we all know someone, either a friend or a sister, who is maybe thinking about having a child. It's just easy to encourage that folic acid and to get prenatal care. So I think that is something almost everybody watching can do. Karen, thank you for your time today. Is there anything else that we need to know about Birth Defects and Prevention Month?
Um, just know that there are resources out there. Do a search on the internet. You can go to the March of Dimes website, the CDC. You can look on the Arkansas Children's website, for example, and also on the Arkansas Reproductive Health Monitoring System website. We do have links and different things like that. You can call us, you can contact me, and we will connect you with some resources.
I like that, encouraging women to definitely seek those out. You are not alone in this, and there are resources available. So, Karen, thank you for your time. We thank everyone for watching. Again, January is Birth Defects and Prevention Month, and Karen has just shared a lot of information and tips for moms or women who are thinking about becoming moms, how to take care of your unborn baby, and then how we take care of them once they get here. So, Karen, thank you again, and thank you for watching, and we will see you next time. In the meantime, please continue to wash your hands, wear your mask, and socially distance when you can, and stay as healthy and safe as possible. We'll see you next time.